Okay, so I'll go ahead and introduce myself. My name is Natalie Rhodes. I am the Marketing Communications Manager for the College of Arts and Sciences here at Lamar. Today we're having a major discussion of our School of Nursing, and our goal is to answer your questions as they relate to being a nursing student at Lamar University. Today we are lucky enough to have Jenny Thedford on with us. She is an instructor of nursing and also oversees recruitment for the nursing program. Also joining us is Carly Pittman. She is one of our admission counselors. She'll be fielding your admission questions and is happy to answer any questions that pertain to the application or any steps that you may need to do before enrolling in classes. Your video is turned off today and your mics are muted to ensure your privacy. You may ask your questions using the chat option in the bottom of your screen. Some of your questions will be answered in the chat and some will also be answered by me or Jenny, but we'll do our best to answer all questions. We're also recording this session for posting on our website. The recording will be closed captioned, so if you want to come back later and watch again, or if your parents would like to watch it, if you have friends interested in nursing, this is a good opportunity for them to check it out later. So we'll go ahead and get started, and I will hand off the mic to Jenny.
Hi, good morning, everybody. My name is Jenny Thedford. I'm an instructor and a nurse. I figure I'm a nurse first. I can't help it. Here at the Dishman School of Nursing. I'm actually at my house. I'm not there. But I'm so glad to be here, and I'm excited to recruit and talk to y'all. And I wish I could see you, but I understand that we are in a unique situation here. So I'm just going to do a few talking points, brief overview of our program. So we are a bachelor's program. We're the Dishman School of Nursing. We're endowed, which is good, which means we get lots of resources. So Miss Dishman, she's still with us. She comes to all of our events. She's awesome. And she's really gives to our students all the time. She's amazing. So when you graduate with us, you'll have a bachelor's in nursing. You enter into our program the beginning of your third year if you follow the curriculum path. So you start at LU and you would talk to Ms. Pittman about that entrance and all those components. And then you would apply to our program right about the middle of your second year. And then if you get accepted, you would come the beginning of your third. So that's sort of the progression. We have a number of programs. So if you graduate with your bachelor's in nursing from us, you could also articulate and go up. And so there's some other programs you have. We have a master's program. We have 2 tracks. We have one in education, which is where I got my degree, my master's of science in nursing. And we have a administrative track. So if you're more interested in management, leadership, and guiding hospitals or programs, then that would be another option for you. We also have an RN to BS program. So if you're already licensed as an LVN, you can also choose that track to do it completely online. So those are different types of programs. So my background is in critical care. I worked in ICUs all over the area for many years, but education called me in and I love it. I love working with students. I love to get to know you guys, and I love how you're all so individual. That is sort of like a patient to me, right? You guys are all kind of my patients. You're all unique and you all have your own needs and ideas and thoughts, and your lives are amazing. So I love to know about that. And so I love critical care, but I also teach in the first semester in the fall. So I get to see you when you first enter the program. And so we go over lots of concepts in that course that I'm in. So that's a good segue into what you might expect that first semester. It is a bit of a challenge to transition into nursing, and we know that. And our administration and our faculty are completely invested in your success, and we try to do everything we can to get you to succeed and move forward and graduate. That's our goal, is for you to be successful. So We also want you to be successful because we measure our success based on you getting a licensure. Okay. And so when you graduate with us, you get a degree, but then you also have to test to become to license as a nurse. And that's really our ultimate goal, is for you to go take your boards. It's called NCLEX, and pass the first time. So that's our goal, and that's what we measure our success at. So we call it the first time pass rates for NCLEX. And our pass rates are very high. So just so you know, you can look that. I know Miss Craig said you received our video, and that has information about our pass rates and all the times that we admit and all that. So just so you know, we really focus on that, and we want you to be successful. And we usually stay above the national average for those first time pass rates, which we're very proud of. Some other things you might think about first year is your schedule. Every semester you will have a practicum experience, and that means possibly going to the hospital or a clinic. The first semester you'll go to lots of different spots, like a long-term care facility, a hospital, and then you'll also visit a pediatric site and do some teaching with well little people. But before we do all of that, we do simulation in our amazing simulation lab. And so you spend at least a month there first, kind of learning the very simple intricacies of how to talk and communicate and assess a patient way before you ever see a real person. We use simulation every semester. We find it to be a great, safe, effective means of teaching you guys how to care for patients and their families. So we do it all the time. And so whenever you come to campus, we can give you a tour and show you how that whole facility and how amazing it is. I think that's kind of all I have. Be glad to open it up for questions.
Yeah. Hey, Jenny, I'm actually glad that you mentioned the simulation center, because that is such a cool part of the nursing program at Lamar. But I think the coolest thing about it is that it's not a graded time.
Correct.
That's time for you to practice and really understand what's expected of patients.
Yes.
And I think that's such a great opportunity for students at Lamar to be able to be in an actual hospital setting without real people for the time being, I guess.
And you're not graded.
Right. Yeah. It's definitely
not
just
a test.
practice.
It's just practice. Yes.
Well, I know that I'm waiting for some questions to come through, but I actually have a couple for you that I've prepared myself.
Okay.
So I know you mentioned that a lot of people will go into the hospitals while they're students. Do they get to work on like a bunch of different kind of units, or do they kind of have to decide which one they want to be on, or will they get an opportunity to kind of rotate?
That's a great question. When you're in the hospital, you will visit a hospital every semester. You also may visit other facilities, but one of the main hospitals in the area you will visit. We do usually rotate you through all the different major hospitals in the area. That's not always your choice, but we do give you options. A lot of times we'll say, pick your top 3 of this or that. We give you, and sometimes we try to make that work every semester. So we really do listen to you. But you will be required to rotate through multiple different types of experiences, and that's in our curriculum. So you'll see the first semester, like I said, you do long-term care. We take care of the elderly. Second semester, you'll do things like surgical sites. So that's usually adults in the surgical area. Third semester, you'll go to pediatrics, and you'll go to labor and delivery. So things like that. And then finally, you'll usually end up you'll have ventured through psychology and psych patients. And so we see when you graduate as a generalist, which means you have kind of touched on all the areas of nursing that you might and will eventually specialize in. So I hope that answered your question.
Yeah, no, that was great. I know when I used to be an admission counselor, I would have people that say, I know I want to be a baby nurse, or I know I want to work in surgery. And so I never really knew if that was something that we were able to do, but I love that.
And I think everybody has a perception of what they want when they come in, but I always encourage students to keep an open mind because it's always different. You may think you're going to hate this one area, but until you really experience it, you never really know. So
Right.
keep your mind open. That's
Right.
what I always encourage the students.
I have another one that just came in, and it said my mom and dad are wanting me to take summer courses when they're home from either like a junior college. Are there certain classes that you want to be taken at Lamar University for the nursing program?
An excellent question. So we do transfer many, many classes, especially prerequisites from colleges in Texas. But the ones that we really, really hold deep to our heart, research shows that if you take pathophysiology at Lamar University, that you will actually improve your percentages of being successful in our program. Pathophysiology is the we are patho based, so all of our curriculum is based on that one course. So obviously it's really important to us. We find it very important, and we think that's why our students are so successful. So that is one we encourage you to take here. We do accept patho courses from other colleges, but we don't recommend it as much. And theories must be taken here, but you can take that online. That is a prerequisite that you have to take at Lamar. That's one that's not, I don't believe, approved from any other colleges.
Okay. It looks like we've got another one. This individual is a senior in high school and have put in 100 clinical hours for their medical class. Can those hours be applied to the program at Lamar? I'm assuming maybe the like a CNA program at their high school.
Gotcha. That is such valuable experience, and I would encourage anybody to, anytime you can enter into some sort of medical realm, to get that experience. But unfortunately, we have to observe that your behavior. We have, when you graduate with a degree from Lamar Nursing, you are a certain type of nurse, and we have to build that. So we have to see how you perform. We want to see how you act with patients. That's not just like the interventions you do, the things you do, but how do you communicate? Are you professional? So we have, unfortunately, that may be something that we could use perhaps in the community-based service learning, but it would not account for practicum hours. Sorry.
I think to the individual that asked that, I mean, that those hours are so valuable for them. I mean, if you're graduating with your LVN or CNA, I'm not sure what it would be, but I mean, you could find a job in that and then have a lot of experience for when you do enter into the nursing program and kind of, continue out that way. That would just be kind of a little step up from everybody else having all of that under your belt.
Yeah, I just think anything that you can do to learn how to work with people is a good thing. Not just caring, but communicating. So I see Ryan has a question. So do you typically graduate in 4 years? That's an excellent question. Nursing is really hard. We do have students that graduate in 4 years. It is definitely doable. I guess I always encourage students to think of it as their own path, and that sometimes we get diversions, whether we plan them or not. We have maybe some have had some diversions this spring. I'm just guessing, right? So things happen. So I don't want you to be too hard on yourselves that if you fall off that path, you're gonna, something's gonna happen. I just feel like every time our paths take a little bend, we usually learn and grow from that. That's my perspective. So embrace the curves in your journey, but yes, it's possible to do in 4 years.
Looks like I had another one come in. It said, what can I expect out of my first semester classes? So I'm assuming as a pre-nursing major, someone's coming in fresh out of high school. What could their class list look like aside from the regular like English or government, something like that?
What Lamar offers for first semesters, so number one, when you enter, be sure that you declare nursing as your major immediately, because it opens avenues for you the second you type that in. So I want you to be sure to do that. And something that you might explore as a first semester student at Lamar, who's a pre-nursing student, is to look at, they have cardinal communities for pre-nursing. And so it's a community where we hook you up with all sorts of resources, and I actually lead one in the fall. So as a nursing instructor, obviously I can give you a lot of insight on your path into the program. And defining, if you don't do cardinal communities, that pre-nursing distinction directly hooks you up with an advisor, pre-nursing advisor, who knows much more about the first 2 years of the program than I could ever help you with. So
I'm actually teaching a cardinal community in the fall too.
oh, cool. Yeah.
I know,
They're so
fun. A dance one, not nursing.
Okay. Well, we can join together. It'd be fun.
Well, I'm still waiting to see if any more come through, and I still have another one. I know that a student is going to apply to the actual nursing program in their sophomore year. What advice would you give them to ensure that they are really getting the most out of their education to get into the program? Because I know it is competitive. Like, are grades a big factor? I mean, what do you guys look at?
Very good question. So I encourage students to think of their grades as different avenues, right? So you have like your science grades, which for nursing is pretty important. So you have like a science GPA, then you have like a traditional GPA for your non-science courses. Pathophysiology obviously is huge. So that probably has more weight in the application process. So just getting good grades, especially in your sciences, is just major. But also you are required to take some HESI tests prior to admission. And those tests really give an idea of your overall knowledge and, like comprehension and things like that, which we find are really valuable. So your pre-nursing advisor can guide you into how to do the best on those HESI tests before you come. There's a couple of questions I see, Natalie, if you want me to address.
If you want
is
to,
anatomy the same as?
It looks like Abigail kind of asked the same question that I did, and you answered it, so that was perfect.
Oh, okay, good.
So
good,
yeah,
yes.
If you want to answer the next one, that'd be awesome.
Okay. Extracurricular activities, you did put that on there. It's valuable for you perhaps when you get a job after you graduate, but we don't necessarily look at that as criteria right now for admission into our program. Anatomy, is that the same as patho? It is not. So anatomy is basically like if you thought of a car and you pulled it apart and how did it work? It's like your body, right? And then pathophysiology is the processes of how those pieces work. So that's more like, how does the engine run? And obviously for us, we also want to know how it runs when it's sick. So pathophysiology talks about wellness and then illness and all the complications that happen and disease processes that occur with patho. So.
Well, I'm going to give Jenny just a quick breather for this moment.
That's okay. I'm good at it.
I want to share with everybody. I know it can get kind of confusing with nursing because you do apply to Lamar University and get accepted as a pre-nursing major. And then you do have to apply for the nursing program at Lamar. So that's one of our only programs at Lamar that requires you to be accepted into 2 programs, basically. I want to clarify that because sometimes it gets confusing. Just because you come in as a pre-nursing major does not mean that you will graduate with a nursing degree. You do have to be accepted into the School of Nursing to continue your education and graduate with your BSN. So sometimes that gets a little confusing. To some students, I just wanted to clarify that we were all on the same page. I don't see any more questions as of right now, but I did want to see if you could talk on the caring place a little bit and just tell everyone what that entails for students at Lamar.
And, you mentioned that about acceptance in, and there was questions about, how do you get in? I think it helps the students to have a goal for GPA. That just made me think of that. And our recruitment and retention committee, we'd like to share information, but we also protect some information. So, but something that we've identified that help you guys become, help you achieve a particular goal is to look at your GPA, overall GPA, and our standard is very low, okay? But students always say, what do I really need to get in? So we try to tell you that if you shoot for a 3.2, that is a very reasonable place for you to focus. So that's just something that we like to talk about, because we usually don't accept too many students below that. So
Hey,
that's
Jenny,
a good
I'm
start.
gonna
And then you
pause you.
asked,
Sorry. I'm gonna pause you for just a second. We're about 5 minutes out until we have to go. So if
okay.
you have anything else that's just super exciting to tell, if not, I'll go ahead and wrap it up.
I think just that our students go everywhere and do so many amazing things. Their opportunities are limitless, and we are. If you join our Facebook page, you can see what our graduates and our current students are doing. So we just sent a bunch of our graduates to New York to practice for COVID and help with that whole pandemic that's affected them. So it's pretty
I
exciting for our
I
students.
had that on my list to share that
Okay.
we have alumni that have graduated from Lamar and are now working in New York to provide healthcare where there's not
Mhm.
enough people to help, and they're putting themselves on the lines. And they did it because of their training at Lamar University, and I just think that's so cool.
Oh, you're gonna make me
Um,
cry.
I have like chills talking about it because I just think it's incredible that Lamar University is support. I mean, they just support you in every way possible, and that goes for any degree that you choose at the university. But your professors are there to really make sure that you're successful and that you graduate with the knowledge to go out and practice, and that's exactly what our nursing students are doing. And
They're
so
awesome.
it's amazing to me. It truly is.
Yeah,
I'm getting teared up about it just
I
thinking
know.
about it
I
because
get
it's
excited.
just so cool. But
Yes. So like our Facebook page, it's the Dishman School of Nursing Facebook page. If you look it up, you'll see us and you'll see all
yeah,
the stuff we do.
yeah. Well, I really just want to thank you, Jenny, for being on today. Thank you, Leela, for interpreting, and thank you to Carly Pittman being here to answer admission questions. I know that she over in the chat has posted her information. My name again is Natalie Rhodes. I'm the Marketing Communications Manager. Keep up on lamar.edu/visit for all of the upcoming opportunities for you to engage. We have these multiple of these events every week, so stay on top of it and feel free to reach out. I'll put my information in the chat section too. And yeah, thank you so much for joining.
I just added my email.
I hope you all have an awesome day and enjoy your upcoming weekend.
Bye. Thank you.
Thank you. Bye.